ulo ng mga nagbabagang balita. General people encounter several challenges while accessing and utilizing the healthcare system because of low health literacy level. Older adult patients and others with members of ethnic or racial minority groups are prone to the highest risk of low health literacy level.
Magandang umaga, nurses! Simulan namin ang balitaan sa issue ng pag-access ng ilang matatanda sa kalusugan. Individuals, especially general people with low health literacy, encounter several challenges while accessing and utilizing healthcare system. The study of the lobby found that the overall prevalence of limited health literacy in the Philippines was 51.5%. with sub-national prevalence estimates ranging from 48.2% to 65.4%. Difficulty accessing information was the most common health literacy aspect that individuals struggled with.
Aling Bebeng, a 63-year-old woman, belongs to the population rate of adult patients having difficulty accessing and comprehending health information due to hearing and visual impairments.
Narito po tayo ngayon sa BBCCC at kasama natin si Aling Bebeng. May mga pagkakataon po ba na nahihirapan kayong intindihin o basahin ang mga reseta ng doktor o mga bili nito tuwing nagpapacheck up kayo?
Oo, ano. Madalas ay hindi ko maintindihan yung mga sinasabi ng doktor sa health center. Kapag gumagamit sila ng mga malalalim na salita, medical terms yata ang tawag doon. Minsan nga ay nakikisuyo ako sa nurse doon kung anong ibig sabihin ng nakasulat sa reseta dahil hindi ko maintindihan. Dagdag mo pa ang pandinig at malabo kong matadala na ng katandaan.
According to her, she can't understand the doctor or nurse's instructions because they use words such as medical terms that she is unfamiliar with or too complicated to understand. She also complains of having difficulty hearing and her vision, and she always needs assistance reading the doctor's prescription. Literacy level refers to a person's ability to read, write, and comprehend written language. Safir and Keenan reported that a significant portion of adults need help understanding health literature, with nearly half being unable to do so. Additionally, around 90 million adults have mediocre to low literacy levels, with 21 to 23 reading at a level equivalent to 5th grade or more down. This poses challenges for elderly individuals with cognitive, visual, or hearing impairments that affect their ability to read and understand healthcare information. Consequently, patients may need help to follow prescription directions and fully comprehend disease prevention information. Doctors must present patients with specific and clear information to assist them in comprehending their medical conditions and its treatments. Sheila Marie Abalos, reporting.
Thank you, Sheila. Follow-up question. Has Aling Bebeng said she wishes to meet her problem?
Yes, Rom. Nabanggit niya na bagamat mahirap na raw niya itong mabago, ang pagkakaroon ng mababang literasiya, partikular sa pag-access ng kalusugan, ay nais niyang matulungan at pagabayan siya ng mga healthcare professionals sa pag-intindi sa mga bagay na dapat niyang gawin upang mapadali ang kanyang paggaling. Dagdag pa niya na younger generation should be serious in taking education in order to be holistically connected with modernization. Rom?
Ibang balita naman, older adult patients and others such as less educated people, lower income people, and members of ethnic or racial minority groups are prone to the highest risk of low health literacy. But there are ways healthcare professionals can handle it, said some University of Baguio clinical instructors. Some student nurses also have ideas about this. At live mula sa University of Baguio, nagpapatrol Cherry Ann Balakwin. Cheryl, ano ba ang komplikasyon sa pagkakaroon ng low health literacy?
Cyrene, patients with the highest risk of low literacy rate are more likely to not receive the proper care for their health. This issue is causing concern among patients in Baguio City, especially those in the highest risk literacy group.
Sa mga pasyente sa Baguio City, lalo na ang mga nasa highest risk literacy group ay nakakaroon ng hirap sa pag-akses sa kalusugan kagaya na lamang ni Alexander Picatose na kabilang sa less educated people.
Sa tingin niyo po ba nakakatanggap kayo ng tamang pangangalaga at paggamit sa iyong kondisyon?
Kung tutuusin, hindi ko sigurado. Nahirapan akong basahin ang mga tagubilin at level ng mga gamot dahil sa limitadong kaalaman ko sa Ingles. Natatakot din ako na baka may hindi ako maintindihan na mahalagang impormasyon kaya nababahala ako sa kondisyon ng aking kalusugan.
Nakahanap ka na ba ng mga sanggunian na makakatulong sa iyo upang mas maunawaan mo ang iyong karamdaman at mga gamot?
Meron ako nasubukan pero mahirap pa rin. Walang masyadong magagamit na impormasyon tungkol sa aking kalusugan, lalo na sa kagaya ko na mababang antas ng literasiya.
Individuals with highest risk literacy are at a higher risk of developing health complications due to a lack of understanding of their health condition. People among these groups who cannot read and write face unique risk related to their lower health literacy levels. As for lower-income people, poverty can negatively affect the client's cognitive development and academic performance. Limited exposure to poor health is an additional challenge clients living in poverty often encounter. Same as true with some ethnic and minority groups, low health literacy can lead to poorer health outcomes, higher healthcare costs, and reduced quality of life for these groups.
We are here now with one of the nursing students of UP. Can I ask, what are your suggestions in improving the life of less educated people?
My suggestions for improving the lives of less educated people is that we provide more accessible learning environment for them that has free access to all, na doon nila ma-discover yung talents nila and other aspects na kung saan field sila magaling.
So how about you, sir? As a nursing student, what can you do or suggest to the government on providing access to medical facilities and products to an ethnic group in their own places?
As a student nurse, I would suggest the government to conduct an assessment of the healthcare needs of these ethnic groups so that they can establish and they can know what are the healthcare needs and priorities of the
As a nurse, have you ever been into a rural place where there are ethnic groups? What was your experience like?
Okay, when it comes now to the ethnic group that you are asking about, during the time that the patient or the students are going for an immersion, okay, pumupunta kami sa mga rural areas, okay, yung mga hindi na-reach, so that we can reach them. Regarding the ethnic, kasi hindi masyado yung kumababa ng dito sa city. And it was really nice to be able to immerse to them, okay, with regards to how they live. It's very simple life. Okay, napaka-simple, napaka-konting gamit. Okay, I think that kind of experience is the one that I cannot forget. Okay, because hindi lahat is given the opportunity to be with them. Okay, even the students. So that it is more in-depth to know their understanding and our understanding on how to cater with this kind of people. Yun lang nasasabi ko.
Ma'am Donna, ask ko lang po, what are some of your encounters with older adults regarding literacy?
Regarding literacy, I can say that there are some older adults that are having difficulty in expressing themselves. So what we need to do is to use simpler terms. Kumbaga, i-guide natin sila kapag sasagot kasi sometimes they take time in answering. So kunwari, we can relate it to them, we can relate it to their activities of daily living. So kunwari, pag may tatanong tayo sa kanila, for example, what do you usually do in the morning? Or what are your usual routines in the morning? So kapag sinabi mo yun, meron ng may agree na yung patient kung ano yung sasabihin niya at that moment. Kapag nawawala naman yung patient, you can guide him or her so that the patient will be able to express his or herself well. So ayun, kailangan lang natin silang guide para kapag kinakausap natin sila, walang dead air. So ayun.
Thank you for the information.
Healthcare providers must recognize and address this risk by providing patients with clear, concise, and culturally appropriate health information. The information should be clear, understandable, and adapted to their culture and language. This way, patients in these groups can better understand their health status and what they need to improve. Cheryl Ann Balakwit, reporting live.
Maraming salamat, Cherry.
Dako naman tayo sa usapang hack and tips para sa ating mga nursing student kung paano i-handle ang mga ganitong sitwasyon. Narito ang mga mag-aaral ng Universidad ng Baguio para ilahad ang mga ito.
Tip number 1. For older adult patients, start with the right body language. A seated position directly opposite the patient improves communication by reducing distractions and sending the message that the care provider has focused on the client completely. Maintaining eye contact is also important because this commands their attention and helps patients to decipher facial cues.
Tip number 2. For less educated people, student nurses need patience and passionate, heartfelt conversation with empathy. Empathy is a foundational building block of meaningful social interaction. It helps us communicate our ideas in a way that makes sense to others and understand others when they communicate to us.
Tip number 3. For lower income people, being mindful of patients' cultural backgrounds and primary languages, consider hiring bilingual staff and being open and transparent about healthcare costs. Tip number 4. For members of ethnic or racial minorities, student nurses should always be aware of their culture and provide respect at all times. This will help clients to be free and indulge all health teachings effectively.
And that concludes our simple but helpful tips.
We hope you can apply this to your future endeavors as a nurse. Thank you everyone and padayon student nurses.
Yun, maraming salamat mga Yubianos.
Magaling, kaya dapat talaga ay client-centered lang mga nurses.
Tama ka dyan, Irene.
Yan po ang balitang pinantayan namin para sa inyo.
Ano mang hamon, ano mang panahon, tapat kaming maglilingkod.
Nandito kami para sa inyo saan man sa Baguio. Ako po si Zyrene Nicotaya.
Ako po si Ael Romaho. Maraming salamat at magandang buhay, Baguio.